Today we are talking about PANS and PANDAS when the brain is on fire. So I want you to imagine that you have an 18-year-old, mostly neurotypical daughter, right? Or patient. By mostly neurotypical, I mean just a little quirky, a little awkward, but overall doing well. She had an acute onset of symptoms several years ago after her sister was sick. And this created a set of symptoms that included an inability to leave the house, an extreme fear of vomiting, depression, suicidal ideation, and aggression against others. So one day she's fine, her sister gets sick, the next day she's not fine. So I always say when I'm training other doctors, when I'm working with families, if it's a long list of diagnoses, we have to test, we have to look deeper, we have to consider that it's more than just the sum of the individual diagnoses. So if someone comes to me and they have this long list of anxiety, maybe OCD, ARFID, maybe reactive attachment disorder, maybe ODD, oppositional defiant disorder, maybe PDA, pathological demand avoidance, maybe they're just called a bad kid, or maybe the parents are just told they're horrible parents, right? When the list is long, we have to look deeper. By and large, you're going to hear it called PANS or PANDAS. All right, so how it all fits together. So think of PANS as the umbrella. You may have an infectious trigger. You may have a metabolic trigger. If the infectious trigger is strep, we call it PANDAS. If the infectious trigger is something else, like viruses, like other bacteria other than strep, tick-borne, then we call it PANS. All right, so let's talk about some common symptoms that we see. So emotionally, what we will often see in kids is anxiety. We will see extreme mood shifts. So they go from 0 to 60 in no time. We also kind of sometimes use a phrase, I hear parents say, it's like they're hulking out. So they're fine until they're not fine. The doctor's willing, but they just don't know what to order, right? So I always start with a CBC, a metabolic panel, vitamin D. I always look at a lipid panel, right? Because I want to see what that total cholesterol looks like. I also look at iron, total iron binding capacity, and ferritin, which is the storage form of iron. It's exceedingly common for kids to be dysregulated in all of these areas. Super low vitamin D, super low cholesterol,